The other big story we are following at 6, the COVID crisis in Indiana is worsening.
Today, the state reports 3,558 new cases of the coronavirus. That is the highest number since January. Of the Hoosiers eligible for the COVID vaccine, just a little more than half of them are fully vaccinated. So half the state is not vaccinated.
And that is leading to a big spike in hospitalizations. For example, today, IU Health says they have 74 COVID patients between both Methodist and University hospitals. Just 5 days ago on Friday, there were 57 patients.
Community Health says they have 93 patients admitted for COVID-19 across their network, and 98 to 99% of those patients are not vaccinated. That shows you the risk people are taking and not getting the vaccine, while those vaccinated are largely protected from hospitalization. Tonight, team coverage showing you the burden local hospitals are facing and what it could all mean for you if you have an emergency.
We begin with Nikki DeMentri live, taking us behind the scenes of a COVID unit at IU Methodist Hospital. Nikki.
Mark, the situation is literally changing by the hour here at Methodist Hospital in downtown Indianapolis. I spoke with one doctor here just a few hours ago who's treating COVID patients here. He originally told me there were 72 patients between here and University Hospital that were inpatient with COVID-19. That number, just a couple hours later, he called me again and said that number was bumped up to 74.
You kind of take a deep breath.
COVID-19 in the Hoosier state.
It's really been a roller coaster ride.
For Dr. Warren GAVIN, it's a roller coaster ride that seems to have no ending. One now that seems preventable as the climb up the hill starts again. The IU hospitalist works on B7, the med-surg floor with a COVID-19 unit. See the yellow carts? Those are COVID-positive patient rooms. On one recent day, between Methodist and University hospitals, 57 patients were receiving treatment for COVID-19.
You're a little bit disheartened, because if you look back just a month or a month and a half ago, we hardly had any cases. Between Methodist and University Hospital, we may have had 8 cases.
90% of those 57 cases were unvaccinated, including all 14 on ventilators.
I pressed them a little bit. I asked them, do you regret, not getting vaccinated? And they say, yeah. And I say, will you please, for me, tell a couple other people that are on the fence kind of what you're going through.
The other 10% vaccinated, but half of those were immunocompromised.
Those patients do relatively well. They come in the hospital and they may be on oxygen for a day or two, they get some therapy, and they go home.
Dr. Gavin's hunch of feeling like there's an increase in COVID patients simply by seeing more yellow carts line his hallway is justified. Fast forward just a few days later, and both hospitals had jumped from 57 to 74 patients. At the height of the pandemic so far, IU Health saw numbers in the triple digits.
Each day you see it, and it's trending in that way.
Dr. Gavin says he truly didn't think he'd see yet another surge.
No, I didn't. I thought with the vaccination that we would have things firmly under control, and so I personally did not think we would be going back up like this.
Yeah. Pure excitement.
How's it feel?
Feels good.
That's how Dr. Gavin described getting his second shot at the IU Health vaccine clinic in January.
I will be walking around with a little bit more confidence. Not like Conor McGregor confidence.
Almost a boxing champion type of confidence from 2 jabs in the arm. 7 months later.
My confidence, it's close. It's probably a little bit lower than Conor McGregor confidence.
He keeps coming back, he says, because he took an oath.
That's what you're asked to do. And it's something that hopefully I see once in my career, and that's it.
Today, Dr. Gavin feels the medical field has a better understanding of fighting this deadly virus. But the same message he told the world in January holds true now.
I think the more people that get vaccinated, the better. But in terms of that final straw for COVID, I don't know.
We heard from the Biden administration just a few hours before this broadcast right now. They were talking about the third shot plan for Americans. Experts are saying that they want Americans to get a third booster shot about 8 months after they're fully vaccinated. Now, right now, for healthcare workers behind me who are fully vaccinated, that time is right now. I asked Dr. Gavin how he is feeling about all of this. He said once he is eligible, he will be getting that third shot.
And Nikki, this has to take such a toll on healthcare workers. We've been talking to Dr. Gavin throughout the pandemic, and it's been continuously just so stressful and hard on them. How are these healthcare staff feeling right now?
Yeah, Amanda, simply put, they're tired. They're tired right now. I spoke with other doctors and nurses and even residents, and one resident said to me this week that she misses the community all coming together. At the beginning of the pandemic, you remember people were out, they were cheering on these healthcare workers, which gave them just a little support as they went into these hospital doors behind me and fought the unknown. They don't have that right now, and they're still going in to fight this unknown. So simply put, they're just tired right now, Amanda.
Our Nikki DeMentri live for us tonight. Nikki, thank you. Nikki also spoke with Dr. Warren Gavin about another serious issue hospitals are facing, one that could have a major impact on anyone who needs medical care.
Unfortunately, I think there was 9 facilities today that were on critical care diversion, meaning they were diverting ambulances away from them because they didn't have the beds, in the critical cares, which is really scary.